If you are going to seek out a medical practitioner's help with hypnosis, what kind of, I mean, do you go to your family practitioner, or who does hypnosis in their, what specialty do you have to go to?
Well, family therapists, psychologists, psychiatrists, even some dentists know hypnosis, and dentists use it for pain control.
So when I had my root canal done, they could have just hypnotized me and...
Well, they could have done some hypnosis with you to reduce the amount of pain medication you could need. There are surgeries out there where, for instance, when there's surgery being done on the eye, the patient is not always put out completely. So some hypnosis can be very helpful for that person.
Knock me out. Please knock me out.
Yeah, I know.
If you're operating on the eyes.
Yeah, well, that's...
Love hypnosis, but knock me out. Okay, you said that some people are more susceptible or more hypnotizable than other people.
Yeah. The majority of the population is easily hypnotized, but there's a smaller percentage of people who have low blood pressure, who are taking blood pressure medication, or some people who might have control issues. And that makes it difficult too, because you don't go into hypnosis if you don't choose to. You have to want yourself to go into it. And even when you get into your car, let's say to drive, and you go into a hypnotic state, you've actually chosen to do that. If you get in the car and you're really focusing on something about the driving, you're not going to go into a hypnotic state if you're not relaxed, if you're tense.
Do you think you could hypnotize Dr. Phil?
Absolutely.
Okay.
Not through the TV, though. You have to be in person.
In person, okay. I was just curious if you'd be susceptible to that or not. So, people who have low blood pressure and things like that should not, or are not ideal candidates.
They're not ideal candidates. They can experience some of the benefits of hypnosis, but they may not get the full physical sensation. People with low blood pressure actually are not going to feel the physical drop that people experience when they go into hypnosis. So sometimes what they do is they lay there and they go, I don't feel anything. Now, hypnosis is not a physical sensation, it's something that takes place in the mind. But most people associate it with a physical sensation, so they're expecting one. So if they don't get that physical experience, they think they're not hypnotized, and then they start focusing on themselves, and stepping outside of themselves, trying to see what they look like in the chair. And if they start doing that, they lose all the benefits of hypnosis.